Okay, we're live. So good morning. It's May 10th. This is Senate Health and Welfare. And we're looking at two bills that have come back to us from the House, S-114 and S-302. And Michelle, thanks for being here.
Sure, good morning. So for the record, Michelle Childs, Office of Legislative Counsel, and we're taking a look at S-114. Would you like me to put it up on the screen?
Please. And let me ask you one question. So what you're putting up on the screen, does it include the amendment, the floor amendment, or is that something that's separate? That the House did?
I'm just showing you the House proposal amendment.
I know, but does it include the amendment that they put on Monday?
Oh, yeah.
Okay,
Yeah, it all gets integrated
All in
before
one.
it comes over here. Yes, it does.
Okay, we're good.
Okay, so the first change is in subsection A. So you see it's creating a working group, and their language is lines 9 and 10, that's a little different, which is purpose of reviewing existing research on the cost benefit profile of the use of psychedelics to improve mental health. Yours was the use of psychedelics to improve physical and mental health. So a slight change.
They don't want to improve physical health?
I guess.
Okay.
Maybe they have worked out.
I bet it, so physical health, people with arthritis, people with, never mind.
So the next changes are on the membership. And so so the changes to this section are that they deleted a representative from the Brattleboro Retreat and a co-founder of the Psychedelic Society of Vermont. And then on page 2, they added the Commissioner of Mental Health or designee and an expert in psychedelic treatment of mental conditions who is affiliated with a Vermont hospital currently providing ketamine therapy appointed by the Commissioner of Mental Health. And I think that was added as part of the floor amendment because by taking out the other groups, they were concerned that certain folks with certain experience weren't going to be able to participate. So on the powers and duties, they kept the first two the same. However, in the Senate version, you'll recall that on subsection A, it had that language, but it also said in the Senate version, it read, review the latest research and evidence of the public health benefits and risk of clinical psychedelic assisted treatments and of criminalization of psychedelics under state law. And they took out that last phrase.
That's too bad. That was supposed to be part of what the working group was doing.
Then they
What's the phrase that which one?
They were supposed to go, sorry.
No,
so on subdivision C.
I see it. I got
1A,
it.
right.
Sorry, yeah.
Then they struck your subdivisions C and D. C was providing an opportunity for individuals with lived experience to provide testimony. And D was to provide potential timelines for universal and equitable access to psychedelic assisted treatments. And they removed those.
So they took out the lived experience
Correct.
and they took out, let me just say, what was the other thing they took out?
Was D, which was provide potential timelines for universal and equitable access to psychedelic assisted treatments.
Okay, let me just make one comment about taking out the person with lived experience. The comment in their committee was that one person with lived experience doesn't make a big difference about in giving information. And the reason that, and then just juxtaposed to that earlier in the committee meeting, the reason for taking out Brattleboro Retreat and the other changes that were made was from one person on the committee with lived experience who said that we should take it out.
A person with lived experience.
Said we should take it out And then at the end of the committee meeting, the comment was that one person with lived experience wouldn't be informative enough. I found that interesting.
Yeah, I'm happy of that.
So we'll go leave it there. It's left on the table, but I just wanted you to know. And so
But taking it out, I'm sorry. Taking it out doesn't mean they can't take testimony from you.
no, that doesn't mean it's bad at all. You're right.
I personally am very disappointed that they took out the conversation about decriminalization. I mean, this is literally a group that's just gonna be talking and looking at data and researching.
I can't believe that they won't look at that, Senator, in the same way that they won't, engage people with lived experience.
Okay.
So, and when we get the report back, we can look at what's there and then make decisions about what's needed next. Why don't we have that information? The research will probably get into that, think about what's going on right now. But
Okay, I mean, it's too bad that we can't have it explicitly in the bill, but I am willing to acquiesce at this point. It's the 11th hour.
that's what happens.
Yeah, well.
So, okay.
So on subdivision C2, remember, you had in there that the working group is to seek testimony from Johns Hopkins, and then you also had decriminalized nature in there because John Hopkins and decriminalized nature were were members as introduced and you moved them to consultation. They removed decriminalized nature. Okay. So for assistance, you'll recall that you had asked and they happily said yes to the Vermont, it was the Vermont Psychological Association.
Yes.
Yeah,
was
Vermont
doing it.
Psychological Association.
And they removed that and they put Department of Mental Health in charge. But then after they did that, Department of Mental Health said, reached out to them after it passed out of committee and they said, you don't have the resources to do that. And so they added on the floor the language you see on line 2, which is in collaboration with the Vermont Psychological Association. So I don't know how that's gonna work, but from staffing, it's an unusual staffing structure, but
Are you gonna just ask them to do it?
Yeah, so, just for the record, Nicole Stadio, the Director of Policy for the Department of Health, this is why I'm here today. We're gonna ask, I think we're concerned that the staff members that would be required to provide the expertise here are the same people that we have a critical shortage of, and so we just want to make sure that we can bring our expertise to the table, but when it comes to managing the group, writing the drafts and all that kind of stuff, that the Vermont Psychological Association kind of takes the lead on that. So that's what the agreement we kind of came to.
Thank you. And the Vermont Psychological Association was so excited to do this
Oh,
work.
I think you're gonna find that they're great collaborators.
yeah, I've never seen somebody so willing to jump at the opportunity to staff.
To write papers and schedule meetings, wonderful.
Right. So with regard to the reporting and the date of the reporting, who they're reporting to, all of that is the same. They did remove the per diems, so there are no longer any per diems for the.
There's nobody on the group that would require one.
No, I mean, I
Okay,
think
good.
arguably people who, if there's someone appointed from, if there's a healthcare professional appointed by one of the associations and, they're in private practice, they're not gonna do that, but I'm sure they'll talk to people, make sure that they're, willing to do that unpaid and.
Well, and the fact of the matter is, I think the per diems are already covered in the budget. So if somebody is in dire straits, we can come back and we can help them out.
So that's it.
Okay, committee thoughts. I know the decrim piece, the lived experience piece. They put back in an organization with experience in this area who might be helpful, and that probably would fall to probable retreat anyway, so. So how are we feeling? All those in favor of concurring with the proposal from the House the day that we're supposed to adjourn? Okay. Are those opposed? Okay, so that's a 3-2, that's fine. But we don't, it's a straw poll anyhow, so
Right.
it's good. But
You can certainly say the majority of the community.
yeah, that's the,
So I'm gonna go over to education, because I showed up late for one yesterday.
thank you.
I did too, and somehow I got reprimanded.
For what?
Nothing.
We'll go off